when you go about looking for a hair transplant center, I know it can be super confusing because Google and YouTube are really full of information. They're choked with information. So, friends, I've prepared a checklist for you which will help you in choosing your center. Hi, I'm Dr. Urvashi Chandra. I've been practicing hair transplants in Delhi for the last 12 years. So, let's come to the point number one. What should you first check? So the number one thing is, friends, the qualification of the doctor. Yes, you should be choosing either a dermatologist or a plastic surgeon. The reason being, in my opinion, the dermatologist is the best person you should go ahead with. I am a dermatologist myself. And let's face it, people who are undergoing hair transplants, they have lost a significant amount of hair. They are already in the process of losing hair. So you need a doctor who can guide you for life for all your hair problems. Your doctor should be able to help you in future also if you have absolutely any hair related issues. And a dermatologist would be very easily be able to do that. Choosing a plastic surgeon or a dermatologist also help you in being very sure that you are in safe hands, because at the end of the day, this is a surgery. It comes along with its little chances of complications. So always make sure that you choose a qualified doctor who is performing in you. Make sure you're not being operated upon by technicians. Now coming over to the second thing. Now that you've checked the qualifications of the doctor, you've checked the experience of the doctor, you've checked the how many years the clinic has been performing. When you actually go ahead with the procedure, on the procedure day, you see that the surgeon that I pinned down upon isn't the person who is operating on me. Who is operating on you? There are some technicians that are operating on you. So then it really does not make sense. So be sure to ask your surgeon, ask your doctor that he or she will be the person who will be operating upon you, and it's not going to be some unqualified technicians doing the surgery while the so-called experienced surgeon is just observing. So just make sure that the surgeon is the one who is doing the surgery. That is the duty of the surgeon. It is not just unethical for technicians to do the procedures, but it is also against the law. So just make sure you check your surgeon that he or she is the one who will be performing the surgery on you. The third very important thing is the technique of the procedure. So I'm sure you must have done your research on hair transplant. You guys know that there are two types of techniques that are available, FUT and FUE. In FUT, an entire piece of skin is cut from the back. It is further sutured up. The strip is further cut up into pieces by technicians. The process is known as slivering. In FUE, the full form of which is follicular unit excision, a strip is not taken out. Rather, individual follicular units are taken out one by one and they are implanted by technicians. But now there are further refinements to the FUE technique that we do at our clinic. We have been using implanter pens. So the traditional FUE technique involves making reception holes. That is a process that is either done by surgeon in probably 10% of the clinics, but 90% of the clinics, technicians are the people who are even making the slits, which is, as I previously said, it's not the correct thing to happen. Further, in the reception holes, the pre-made reception holes, the grafts are pushed in using a forceps. Now this entire process of holding the grafts with a forceps and pushing them in increases the chance of graft damage. So the graft survival rate might drop. So suppose 4,000 grafts have been implanted, it is possible that only 3,500 grow. So 500 grafts have got wasted. Whereas in the implanter pen technique, which only 0.1% clinics across the world use because it needs a lot of expertise, it needs a lot of devotion from the doctor's side. The doctor has to devote a lot of time and effort into the procedure, which is why only very few clinics across the world are using this specific instrument which we call implanter pen. Now, what are the advantages of the implanter pen? First of all, you get a 100% natural result because with the implanter pen, we are very easily able to monitor the angle and direction. We are able to be very precise with the angle and direction of the implanted hair. The second huge advantage is that because handling is very minimal, so the graft survival rate is very high. So we assure all our patients of a very high graft survival rate, which is practically a little tough with the reception hole technique. The other thing that you need to look at for the technique is the FUE technique, is whether the extraction is being done by dull motorized punches or whether it is being done by sharp manual punches. Through a lot of scientific papers and data and studies that have been conducted across the globe, it is now proven that manual sharp extraction is one of the best, finest, and the most gentle way to extract, because it gives very beautiful, nice, intact follicular units which are not transected. Secondly, the healing of the donor area is excellent. So, always make sure that even when you are choosing the FUE procedure, you need to check with the surgeon exactly how the procedure is being done. What are the instruments that are being used? Are the implanter pens used or not? Are the fine, ultra fine, sharp punches used or not? Or are dull motorized punches being used? The additional advantage of the sharp ultra fine punch is that the healing in the donor area is very, very quick. Also, the scarring is minimal as compared to the dull motorized punch. And again, like I said, there have been multiple studies across the world, and all these things have been now proven. Coming to the next thing is the educational, let's say, endeavors of the doctor. So you would obviously like your hair transplant surgeon to be a person who keeps himself or herself updated with the latest developments, with the latest technologies. So you need to make sure that your doctor is a part of global societies like ISHRS and ABHRS. These societies ensure that the doctor is all the time updated with the latest technology, the newest developments in the field of hair transplant. Your doctor should be going to conferences, your doctor should be purchasing books and reading new journals. All these are very important because medical technology is evolving every day by the hour, in fact, I would say. So, that is why it's very important that your doctor should be very actively involved in the learning process. He or she should be able to tell you that we've been to recent conferences, learned new things, given lectures to fellow dermatologists. So that is again a very important pointer, that your surgeon is actively involved in not just doing surgeries but also learning new things. That's very important. And the last, but I would say the most important thing, is the surgical planning of the surgeon. So when you visit your doctor, what does the doctor do? Does the doctor just start explaining their technique, or does the doctor just talk about his or her clinic? No, that's not really important. What you need is the surgeon to look at you, examine you carefully, tell you how your donor area is, plan your area of hair loss, how much grafts would be needed, what is the kind of density that we'll be giving you. Is it going to be 30 grafts per centimeter square? Is it going to be 40 grafts per centimeter square, or 50? So these are some things that the doctor should be able to tell you, whether you have that kind of a scalp donor reserve to cover that area, or whether we need to take grafts from the beard or the chest. In case you don't have that much donor area from the scalp, obviously we'll have to move over to the beard or the chest. Also, the doctor should be able to tell you that in case you're young and you have progressed a lot, you had a lot of hair fall, hair loss, then in the future also it will progress even more. So if you're a young person and you've lost a lot of hair, you're probably not the best candidate for a hair transplant. You would want your surgeon or your doctor to give you genuine advice. So if you're not a good candidate, then your doctor should very openly, frankly tell you that you're not a good candidate, you don't have a good donor area, we have too much area to cover, we might not be able to get so many grafts, you are progressing too rapidly, we might have to delay the procedure till your hair loss is stabilized. So you would want your doctor to guide you genuinely. That is very important, because hair loss is something that is going to progress in the future. Also, you'll have more hair fall. The androgenetic alopecia is going to go to higher grades. So in that case, suppose we even do a transplant today, tomorrow you might need another transplant session. So from where is your surgeon planning to take the grafts that time? What is your hairline going to be right now? If you're a young person, you've lost a lot of hair, and your surgeon is drawing a hairline right here, very low, then I would personally doubt the person's experience. Because if you have a lot of hair fall, then your hairline should be drawn up. So there are so many minor things that your surgeon should be able to guide you on, that we need to draw a more natural looking hairline which is slightly up above. We need to manage your donor area also. In the future, if the doctor thinks that the donor area might not be sufficient for future transplants, then probably you're not a good candidate for a transplant. So there are so many things. These are some factors. It's a checklist which you can always carry with you to any clinic you visit, and just to make sure that you are able to find your clinic, a good clinic. Trying to find the best hair transplant surgeon or the best hair transplant clinic is a little impractical, and in fact I'd say impossible, because there is really no the best. There are so many clinics and so many doctors who are doing a very good job, very good hair transplants, and that is why the hair transplant industry is growing by the day. If there were only very few doctors who were doing a good job, then hair transplants would not have been growing like they are growing right now. So what's important is not really to look for the best hair transplant clinic, but it's the idea is to stay safe. The idea is to stay away from clinics that are not guiding you correctly, that are not run by experienced doctors, that are purely based on sales and business, and the doctor or the clinic is not really concerned about your hair loss, but their interests are coming before your interest. So we just need to stay safe and stay clear from such clinics, and choose our clinic where the doctor is experienced, qualified, and will give you genuine guidance. So friends, I hope this video helps, and best of luck for your research for your hair transplant center. Bye bye.